We're here in the office today, about roughly 7 weeks, status post an operation, which was a resection or removal of this patient's sural nerve. The sural nerve comes back from the leg, down the leg, and into the side of the foot, and then down into the fourth and fifth, maybe the fifth toe in this area right here. This patient had an Achilles tendon rupture, and he required a repair of this Achilles tendon. But right after the repair, he immediately knew that something was wrong, and there was a lot of discomfort and pain here. And I'll let the patient tell you the story about what it felt like. So tell us what your symptoms were like before we operated on you, and what were the symptoms that led you to believe that something was not right?
Yeah, so I mean the symptoms before this operation, like any time anything would touch really down here or beneath this portion on the original repair, would be like burning, stabbing pains, so like a hot knife was going into my leg and down my foot, down in this direction.
So this right here, this transverse scar, was the original incision, and you can see that there's, the Achilles tendon is right underneath here. The further you get out here, the more likely you are to have either a retraction injury or even an inadvertent injury to the sural nerve, which is well known, so doctors are very careful about that. But if you do enough of these, one day something will get caught. So tell us what happened when you tapped right there, and what did that do to you?
That would be like shooting like sparks and electricity pains down the leg. Be like very, very painful. And yeah, I mean, anytime I would get tapped or brushed or, walking even, just the rubbing of my sock on it would cause like shooting pains and electricity and, burning sensations down my foot.
Okay. And so that's called a neuroma. We have a little drawing up here. What that cause a neuroma, when you get the end of a nerve ending here, it gets cut or stuck in a scar tissue, and it can start to try to regrow because it's been injured, and it forms a ball on the end of it called a neuroma, which can be very uncomfortable and can trigger pain like that. It's a pretty darn classic situation here. So pain after a previous operation. So we decided we had a couple options. One, we could remove that nerve and get rid of it and put it in a safer place than the ankle, because the ankle's easily traumatized, as you can tell. The other option is to try to rebuild it. So either option is reasonable in this particular nerve, the sural nerve, because it's an expendable nerve, and we take it to reconstruct other branches of nerves that are more important sometimes. But in this gentleman, we moved ahead and with a nerve resection or removal of that branch, and we implanted it behind the thigh and behind the knee here, where it's a little more protected. So you can imagine when you're walking, this moves a lot. He's a soccer player. It can be easily kicked. It drove him crazy. Whereas up here, much less likely to be injured. And while we still have a potential to have that neuroma, we actually put a wire cap on the end of that nerve and put it into muscle so that we try to prevent those neuromas from coming back. So tell us what this feels like now. It's been 6 to 7 weeks. He's not completely recovered yet. But when we take out a nerve, we obviously expect to have some numbness. So tell us what's been going on with you.
Yeah, so I mean, now pretty much this is just completely numb for the most part. Around the edges of it, like up here I have sensation, and around the edges there's still a little bit of tingling sensation, but that's been, going down over time. But yeah, it's, for the most part, it's just entirely numb now, and bruising and tingling has been getting better week by week here. And
is that a pleasant numbness or an unpleasant numbness in this particular situation?
Compared to the pain prior, it's very pleasant.
Okay.
It's, whereas before I noticed, I would always kind of be walking with a limp in a sense of like keeping my ankle still to keep it from moving the neuroma. I've noticed that I actually can start like pushing off my toe again now and like actually walking normal, which is a huge relief, and have it not cause pain. So it's been a huge improvement over the the pain that was there prior to this surgery.
Great. So if you were to, and again, we're only about 6 to 7 weeks out, so we're not finished healing yet, but if you had to give us a percentage of improvement from where you were today compared to where you were the day before surgery, what would you say? How much improvement do you think you have?
I'd say at least like 90%, and increasing still as well, if not like 95 or higher. You know, it's hard for me to put an exact number on it.
Sure,
but,
of course.
Very significantly improved.
Very good. All right. Well, thank you so much. I appreciate it. We'll continue to follow this, and I expect the sensation to creep in and to be slowly improved over time, and I expect that residual sort of bruise sensation and some of the buzzy, tingly at the end of the edges to shrink as the nerves from the neighboring nerves grow in. And it can take about 6 months to a year, but that's usually ends around 4 to 6 months, where patients no longer see a daily or weekly or even monthly improvement. So thank you so much.
Thank you.